Hello everyone, welcome to Nurse Expertise, where we share useful information and tips for nurses and healthcare professionals. In this video, we are going to talk about pacemakers, which are devices that help the heart beat at a regular and healthy pace. Hello Hassan, can you tell us what is a pacemaker exactly?
Well, a pacemaker is an electronic device that provides electrical stimuli to the heart muscle. Pacemakers consist of two components, an electronic pulse generator and pacemaker electrodes, which are located on leads or wires. The generator contains the circuitry and batteries that determine the rate, measured in beats per minute, and the strength or output of the electrical stimulus delivered to the heart, measured in milliamperes. The generator also has circuitry that can detect the intracardiac electrical activity to cause an appropriate response. Leads which carry the impulse created by the generator to the heart can be treated by fluoroscopy through a major vein into the heart, usually the right atrium and ventricle. This is for endocardial leads, or they can be lightly sutured onto the outside of the heart and brought through the chest wall during open heart surgery. And this is for epicardial wires. The epicardial wires are always temporary. Also, the temporary external adhesive skin pads may be used before placing the wires. The endocardial leads may be temporarily placed with catheters through a vein, usually the femoral, subclavian, or internal jugular vein. This is for transvenous wires, usually guided by a fluoroscopy. The endocardial leads also may be placed permanently, passed into the heart through the subclavian, axillary, or cephalic vein, and connected to the permanent generator. Now you might be wondering, why do some people need a pacemaker? There are many reasons, but the most common ones are symptomatic bradycardia. This can cause symptoms like fatigue, dizziness, fainting, or shortness of breath. The other one is complete AV block with resultant intermittent asystole. This can cause the heart to stop beating for a few seconds or longer, which is very dangerous and can lead to a sudden cardiac arrest. The other indication is the heart has a problem with the natural pacemaker of the heart, which is called the sinus node. This can cause the heart to beat irregularly, too fast or too slow, which is called sinus node dysfunction. Other indication is for patients at high risk of complete atrioventricular block. This can cause the heart to pump blood inefficiently, which is called heart failure. And the last indication is infranodal conduction system disease.
So, how do pacemakers work?
Well, there are different types of pacemakers, depending on how they are implanted, how many chambers of the heart they stimulate, and how they respond to the heart's activity. I'll explain some of them. Well, temporary pacemakers are used for a short period of time, usually in a hospital setting, to treat a temporary heart problem, such as after a heart attack or heart surgery. They are removed when the heart recovers or when a permanent pacemaker is implanted. Permanent pacemakers are used for a long-term treatment of chronic heart problem. They can last for several years before the battery needs to be replaced. Single-chamber pacemakers are pacemakers that stimulate only one chamber of the heart, usually the right ventricle, which is the lower right chamber. They are used for people who have a problem with the electrical signals in the lower part of the heart. Dual-chamber pacemakers are pacemakers that stimulate two chambers of the heart, usually the right atrium and the right ventricle, which are the upper and lower right chambers. They are used for people who have a problem with the electrical signal in both the upper and lower part of the heart. Biventricular pacemakers are pacemakers that stimulate both ventricles, which are the lower chambers of the heart. They are also called cardiac resynchronization therapy, or CRT. They are used for people who have a heart failure and a slow heartbeat. They help the ventricles contract at the same time, which improves the heart's pumping ability and reduces the symptoms of heart failure. Leadless pacemakers are pacemakers that do not have any leads or wires. They are implanted inside the heart itself by using a catheter that goes through a vein in the groin. They are used for people who have a problem with electrical signals in the lower part of the heart. One more thing to note is that some people may need a device that can do more than just pace the heart. They may need a device that can also shock the heart if it beats too fast or too chaotically, which is called an arrhythmia. This device is called an implantable cardioverter defibrillator, or ICD. It looks similar to a pacemaker, but it is slightly larger. It works like a pacemaker, but it can also detect and treat dangerous arrhythmias by delivering a high-energy shock to the heart, which restores a normal heartbeat. Some devices can combine a pacemaker and an ICD in one unit for people who need both functions. In the next video, we will talk about the different modes of pacing that pacemakers can use and how they affect the heart's function.
Let's talk about the procedure. Can you tell us what permanent pacemaker implantation is and how it is done?
A permanent pacemaker implantation procedure is a minor surgery that can be done in a hospital or a special heart treatment lab. The doctor inserts a needle into a large vein near the neck or shoulder of your non-dominant hand. Then uses the needle to treat the pacemaker wires into the vein and correctly place it in your heart. To ensure proper placement, the procedure is done under X-ray image guidance. The doctor will make a small cut into the skin of your chest or abdomen to create a small pocket under your skin where they place the pacemaker's small metal box containing the pacemaker's battery and generator. They will then connect the metal box to the wires that lead to your heart. Then tests for the proper functioning of the pacemakers are done. The proper functioning results includes heartbeats and rate at apical and distal peripheral pulse detection in terms of clinical assessment and in combination with electrocardiogram. Also, particularly spikes as a pacemaker creates impulses and captures as responses to each impulse in ECG as appropriate. Once the pacemaker's functioning is ensured, the doctor will apply sutures to close the cut. A sterile dressing is applied and an arm restraint or immobilizer is applied to the arm on the side of the surgery for 12 to 24 hours to limit movement.
What kind of complications can occur?
Well, there are some potential complications that can happen. Although they are rare, some of them are: one is local infection, two is pneumothorax or collapsed lung, three is bleeding and hematoma or blood accumulation under the skin, four is hemothorax, it means blood in the space between the lung and the chest wall. 5 is ventricular ectopy and tachycardia or irregularly or fast heartbeats. 6 is lead displacement or perforation. 7 is phrenic nerve, diaphragmatic or skeletal muscle stimulation. 8 is cardiac perforation, pericardial effusion or cardiac tamponade. 9 is Twiddler syndrome. It means pacemaker's wires coiling or breaking. And the last is pacemaker syndrome. This is when the patient feels dizzy, faint, or short of breath.
Could you tell us about nursing management?
Certainly. When it comes to permanent pacemaker management, it's crucial to ensure confirmation of pacemaker placement post-implantation through an initial insertion with a baseline chest X-ray. Additionally, documenting patient's data in the patient's permanent record for the initial insertion of the pacemaker is essential, including details such as the manufacturer, model number, implant date, upper and lower rate limits for rate-responsive devices, and whether it's a unipolar or bipolar lead system, as well as the capability for pacing and/or shock delivery.
After the permanent electronic device, such as a pacemaker or ICD, is inserted, what are the key monitoring and assessment procedures that nurses need to follow?
Following the insertion of a permanent electronic device, the patient's heart rate and rhythm are monitored by ECG, noting the frequency and duration of any dysrhythmias. The device's settings are then compared with the ECG recordings to assess the device's function. Furthermore, nurses monitor for signs of improved cardiac output and hemodynamic stability at specific intervals after initiating pacing, aiming to identify the patient's response to pacing and the adequacy of pacing as per the facility's protocol.
What measures should nurses take to monitor and address potential complications associated with pacemaker insertion?
Nurses must vigilantly monitor for signs of failure to pace, capture, sense, and determine the cause, which may include lead dislodgement, fracture, pacing at a voltage lower than the capture threshold, or sensitivity set too high. Additionally, they should observe the incision site where the generator was implanted and promptly address any issues such as bleeding, hematoma formation, or infection, which may be evidenced by swelling, soreness, unusual tenderness, and any unusual drainage and increased warmth. The patients may complain of continuous throbbing or pain. These symptoms are reported to the primary provider. The comprehensive appraisal of peripheral circulation, including checking peripheral pulses, edema, capillary refill, skin temperature, and diaphoresis, is also crucial in the initial assessment of pacemaker patients. Nurses should monitor drug and electrolyte levels for patients receiving concurrent antiarrhythmic medications.
How do nurses educate and support patients with newly implanted pacemakers?
Nurses play a pivotal role in providing patients and their families with comprehensive information related to pacemaker implantation, including indications, functions, programming codes, and potential complications. Moreover, they should instruct patients about potential hazards for electromagnetic interference from outside source. For example, do not leave cell phone in the on mode in a shirt pocket over the pacemaker, magnetic resonance imaging, radiation treatments, and provide guidance on refraining from certain activities such as operating motor vehicles until permitted. Educating patients about the signs and symptoms of dysfunctional pacemakers. For example, bradycardia less than 30 beats per minute, dizziness, weakness, fatigue, chest discomfort, shortness of breath, orthopnea, pedal edema, hypotension, near syncope, and cardiac arrest. Nurses should instruct patients to carry manufacturer identification card at all times. Nurses should instruct patients on the special consideration at government security gates or the airport. For example, always inform security guard of implantable pacemaker, walk through the security gates, do not allow handheld metal detectors near the device site, ask to be searched by hand. Nurses can provide concrete information related to the effects of pacemaker therapy to reduce patients' uncertainty, fear, and anxiety. Nurses should instruct the patients and family about activities that are safe and those that may be dangerous. The nurse may facilitate CPR training for the family.
Moving on to the temporary pacemaker management, what are the key considerations and procedures that nurses should be mindful of?
When dealing with temporary pacemaker management, nurses need to determine the indication for temporary pacing and the intended duration of pacing support. Additionally, they should apply external transcutaneous pacemaker electrodes to clean, dry skin on the left anterior chest and the posterior chest as appropriate, and provide appropriate sedation for patients as indicated. They should set rate sensitivity according to patient's need as directed by physician, and they should monitor patients for 4 things. 1. Monitor patient's response to the settings, monitor for presence of pace rhythm, monitor for signs of improved cardiac output, monitor for conditions that potentially influence capture and sensing like electrolyte or metabolic abnormalities, certain medications, tissue inflammation, tissue necrosis. And then they should inspect skin frequently to prevent potential burns, and providing suitable incisional care for pacemakers with insertion sites are critical steps in ensuring effective temporary pacemakers management.
Are there any precautions or restrictions that nurses need to communicate to patients and their family members regarding temporary pacemaker usage?
Absolutely. It's crucial for nurses to educate patients and their family members about the symptoms to report, such as dizziness, fainting, palpitations, chest pain, and difficulty breathing. Furthermore, they should provide comprehensive instructions on the precautions and restrictions required when a temporary pacemaker is in place, including limitations on movement and the avoidance of handling the pacemaker to ensure the patient's safety and well-being.
Lastly, can you elaborate on any specific prohibitions or risks associated with MRI studies after pacemaker or ICD implantation?
After pacemaker or ICD implantation, it's imperative to communicate to patients that going under MRI studies is forbidden due to potential risks. This restriction serves to safeguard the well-being and proper functioning of the implanted device. This comprehensive approach to pacemaker management by nurses ensures the holistic care and well-being of patients with permanent or temporary pacemakers, involving through monitoring, education, and support throughout the process.
That's it for the first part of Explanation Pacemaker. In the next part, we will explain modes of pacing in detail, so don't miss the next video, and to do that, subscribe to our channel, and don't forget to like, comment, and share our videos to your friends. Stay healthy, stay informed.